Hello, I'm Sean Park, and today we are going to talk about cystitis versus vaginitis. So the term cystitis is meaning that there is an inflammation in your bladder. Vaginitis means that there is an inflammation in your vagina. But why is it important to know the differences? Vaginitis happens frequently. Naturally, a vagina is an open space toward the outer world. So it's a hollow organ open toward it, just like a mouth. So there are quite a lot of germs living there, and they depend on your hormonal levels. Hormonal fluctuation can affect the vaginal microbial environment. Let's say if your hormone level is affected by your stress, physical stress, emotional stress, or just out of your hormonal imbalance, time to time vaginitis can happen. That kind of vaginitis is usually self-limited, and then you do not need any other treatments. Symptoms of the vaginitis are increased discharge, or the unusual smell, or spotting, like a little bleeding happens, or throughout intercourse you may have some pain. So those things are vaginitis symptoms. Like I said, sometimes they will self-limited, but if they sustain longer than 3 or 4 days, you may need to get treated or get tested. But still, they do not impose an acute treatment or acute situations. But still, untreated, they can cause pelvic inflammatory disease or the infertility. But cystitis is different. The symptom of the cystitis is related with the voiding things, like if you feel sudden frequency, or the painful urination, or little abdominal pain in the down there, then you may have a cystitis. Cystitis is usually happen because of the bacterial infection in the bladder. Women's urethra is quite short compared to the man. A man has about 18 to 19 centimeter long urethra, so bacteria has a hard time to ascend it and making an infection in the bladder. So young and healthy male seldom have a bladder infection. If they have one, they may have a serious immune compromised status. But for women, they only have a 7 to 8 centimeters, pretty short urethra, sometimes 6 centimeters. So the bacteria has an easier time ascending to the bladder. And also, throughout the intercourse, as the vaginal orifice and the urethra is pretty close, and some women has even especially closer distance between these two holes. After the intercourse, they may have an infection due to the vaginal germs can be refluxed to the urethra. So that we call as a honeymoon cystitis. So if the infection happens, it usually caused by the bacteria, and they never go away by itself. They will almost always leave a sequelae. As the bladder is connected with the kidney through the ureter, so if the untreated bladder infection sustains, they can infect the kidney as well. That's what we call pyelonephritis, infection of the kidney. When kidneys got infected, things get much ugly. Because every time you get an infection in your kidney, there will be a permanent scarring happens in your kidney. That part of the kidney loses its function. So if the kidney infection frequently happens back and forth again and again and again, the kidney function will be permanently damaged, and you may need replacement for your kidney. Also, pyelonephritis can make systemic infections like a sepsis, and sometimes patients need a serious treatment because of that. So whenever you have a cystitis symptoms, you have to go to the doctor's office right away. Don't wait it. And in South Korea, all the antibiotics are prescriptional drugs, which means that you can buy on the counter. So do find a urologist or gynecologist, internal medicine guys, whatever, in doctor's office, to visit them and get a treatment. Because if untreated cystitis becomes a pyelonephritis, sometimes it can really kill the patient. So cystitis and vaginitis, they are different. The symptoms are different, and don't be confused. Your cystitis symptom is needs a much more acute attention than the vaginitis. If you know that, you'll be fine. So as you know the difference with the cystitis and vaginitis, do remember, because if you can differentiate the symptoms, then you know whether you need to go to the doctor's office right away or not. Take care of yourself is very important. In the young days, you may think that you are invincible, but you are not. You are getting aged. So remember, you need a treatment if you have cystitis symptoms.